The French government is calling on all hospitals around the country to prepare for a new wave of the coronavirus. This warning follows a surge of cases of English, South African and Brazilian variant strains. There's concern especially about the rapid spread in eastern and northern France and in the Paris region. Well, to talk a bit more about this with me now, I'm joined on the set by our foreign affairs editor, Philip Turle. Philip, first of all, tell us a bit more about this new alert from the government.
Well, there's good, there's bad, and there's worrying news, Jeannie. The good news is that the infection rate in France has started to go down slightly, but the bad news is it's still too high. Latest figures say 19,590 infections in the last 24 hours and 410 deaths. And the worrying news is that, as you were just saying, there's been a spike in the number of cases of the British variant, responsible now for 20 to 25% of infections in France, while the South African and Brazilian variants up to about 4 to 5%, and officials say they expect the British variant to be the dominant form in the next month. Now, this map here shows the areas of France which are worst affected. You'll see the north of France, the east of France, and the southeast of France are the ones that are worst affected. That's why the government has decided to bring in this French hospital emergency plan, which is due to come into effect tomorrow. That's Thursday by 6 p.m. There are two plans. The first one is the white plan. That's the one that's going to come into effect. What the government wants is for the mobilisation of all medical personnel to be ready to intervene if they need to, if there is a sudden spike in the number of cases. Extra beds to be made available. How will they do that? They're going to encourage more people to stay at home, to delay their treatment if it's not essential, and also if they need oxygen, to ask that oxygen be supplied in their home and they don't have to come to the hospital for it. And for all non-essential treatment, as I said, to be postponed, and the requisition of hospital staff to work as many hours as they can, to have, for example, paid holidays or to have increased bonuses during overtime. That is the plan. They're saying all hospitals nationwide have got to be ready for that by tomorrow. Now, the blue plan is the other one, which is the requisition of medical centres and the possible confinement of care home residents. That's not on the table at the moment, but if things get really bad, that might also be brought back into operation.
So far, Philip, the French government has refused to go with a nationwide lockdown, but there has also been a lot of frustration from many people about the slow rollout of the vaccines. Tell us a bit more about that.
Yeah, so first point there is the government has introduced measures which they say are working. There is pressure from medical workers to bring in a new confinement. They say that would certainly cut down the number of cases, but the government's reluctant to do that. They say we've got a nationwide curfew every day from 6 p.m. to 6 a.m. Cafes, restaurants, museums, theatres and cinemas are closed, and large shopping centres unless they sell food. And there's no travel outside the EU. They say that is enough for the moment. It's keeping the situation stable. They don't want a new confinement to have a knock-on effect on the economy, and they don't also want to have any riots like we've seen in the Netherlands, for example. That is something that President Emmanuel Macron certainly wants to avoid, because he knows that 40% of French people are not in favour of a new lockdown. So for the moment, they're going to stay with just the confinement, hoping that is going to be enough. It seems to be working, Jeannie. As far as the vaccines are concerned, you might remember the EU Commission Chief Ursula von der Leyen went on the record last week as saying that the whole vaccine situation in Europe had been far too slow, and she admitted that, but she said that Europe had been far too optimistic. Emmanuel Macron is backing her, and also she's been backed by the German Chancellor Angela Merkel, because they want a European vaccination system. They don't want each of the 27 European nations to go it alone. They say there would be strength in numbers, therefore Europe has to have a European response to the COVID-19 outbreak. But there is criticism it's far too slow. There are 3 million people vaccinated in France, 5 times more in the UK, which is now no longer in the EU. So a lot of people are saying, well, look, what's going on? Why aren't we getting more people vaccinated? And I think the government wants to get this going as soon as they can.
Philip, thank you for that. France 24's Philip Turle. Thanks to you.